Pharmacokinetics is basically what our body does to the drug. There are four main processes. 1. Absorption. 2. Distribution. 3. Metabolism. 4. Excretion. So, the drug we take needs to pass through these four processes. Absorption. It is the movement of drug from the site of administration to reach the systemic circulation. Or, the process by which the drug reaches to systemic circulation is known as absorption. IV drugs directly enter systemic circulation, so no need of absorption. Whereas when drug is given through oral route, it has to cross mucosal barrier, or we can say pass through the cells of stomach/intestine. Lipid solubility of drug and pH is very important for absorption. 1. Lipid solubility because the cell membrane of the cells present in stomach and intestine are made of phospholipids. 2. pH as there are acidic, basic, and neutral drugs, so, for example, important point, insulin and heparin are not given by mouth because they are made of protein. In the stomach, strong acids and enzymes can break them down before they have a chance to work. Even if they are not destroyed, they cannot pass through the walls of the intestine easily because they are water-soluble and too large to be absorbed into the blood. That's why they are usually given by injection. Types of transport for absorption of drug. 1. Passive diffusion. Movement of drug molecules from a region of high concentration to low concentration without energy. No carrier required. Depends on lipophilicity and molecular size. Example, absorption of aspirin from the stomach. 2. Facilitated diffusion. Drug move along concentration gradient, but requires a carrier protein. No energy required. Example, uptake of glucose into cells via glut transporters. 3. Active transport. Movement against concentration gradient, using energy, ADP. Requires carrier. Energy dependent. Example, absorption of levodopa via amino acid transporter in the intestine. Most drugs are weak acids or weak bases and are neither completely lipid-soluble nor water-soluble. Their solubility depends on the pH of the environment. Acidic drugs become more lipid-soluble in acidic pH, unionized, and more water-soluble in basic pH, ionized. In contrast, basic drugs are more lipid-soluble in basic pH and more water-soluble in acidic pH. Only the lipid-soluble, unionized form of a drug can easily cross cell membranes, so pH plays a key role in drug absorption and distribution in the body. First-pass metabolism. First-pass metabolism is when a drug gets partially broken down, metabolized, before it reaches the bloodstream. Mainly this process occurs in liver. When you take a drug through the oral route, it is absorbed mainly in the small intestine, rarely in the stomach. Once absorbed, 1. The drug enters the hepatic portal vein. 2. This vein carries the drug to the liver. 3. In the liver, some portion of the drug is metabolized, broken down. This is called first-pass metabolism. 4. The portion of the drug that remains unchanged after this process enters the systemic circulation and starts working. Bioavailability, amount of drug that reaches the systemic circulation. Drug with high first-pass metabolism have low bioavailability. Examples of the drug with high first-pass metabolism are nitroglycerin, morphine, etc. Oral route equals less than 100% bioavailability. 4 route equals 100% bioavailability. Thank you. Subscribe for part 2 of Pharmacokinetics, distribution of